There's this thing in medicine where I wouldn't necessarily call it tension between the orthopods and the internal medicine physicians or doctors. It's just a misunderstanding.
Okay, let's order an EKG and a troponin. What up, med bros?
Can you imagine if another specialist just walks into the room, especially an ortho person, and just bombards their rounds asking for a patient to be admitted?
Ortho, what do you want? How would you like to admit the patient I just operated on? Oh, of course, we'd love to. Really? No. Come on, man. Dude, please, this patient has everything you guys like. Neck veins, a surgical incision you don't have to look at, sodium. Sodium, that's your pitch. The patient has sodium. Their body's full of it. I know how much you guys like sodium. I do kind of like No, that's not gonna work this time. Fine. I'll take care of my patient all by myself. Tim, yeah, what up, boss? What kind of non-bone related problems does our patient have? High blood pressure. Okay, keep the top number higher than the bottom number. Don't let it go to 0. What else? I don't know. The patient's taking 25 medications. Okay. Continue 3 of the most important ones and switch all the others to ANSAF. Just stop, okay? We'll admit the patient. Yes.
Oh, so that was hilarious. There's this thing in medicine where I wouldn't necessarily call it tension between the orthopods and the internal medicine physicians or doctors. It's just a misunderstanding. If patients come to the hospital, let's say they come for a hip fracture. Well, some of these patients have other things, comorbidities, medical problems, high blood pressure, heart disease, maybe they had a cardiac stent before in the past, maybe COPD, asthma. And some of these patients, especially patients who break their hips, they're on multiple medications. When I was a resident, I can attest to that, there was a lot of tension at times between the ortho team and the internal medicine team. The reason for that is because a lot of the internal medicine physicians, even though they're great and they're well trained, they sometimes feel like ortho is dumping a patient onto their service. Well, this is not necessarily always the case. The question I have for everyone is that if you have a grandmother who breaks their hip, or if you have someone who's in a motor vehicle accident, who's 70 years old, who's 60 years old, would you want an orthopedic surgeon managing that patient's blood sugar or their blood pressure or titrating certain medications? And I can see the patients that come in that may not have any medical problems. Sure, we should be taking those patients on our service and call the hospitalist or any other consulting services if there's an issue. The way it works is that a patient comes into the hospital, the patient is seen in the emergency room by a ER doctor, and there are consulting services that are rendered. If a patient, let's say, is on the orthopedic service and needs some type of cardiac eval, or they're having chest pain, we're going to call the cardiologist. If I'm operating and taking care of a patient now that I'm in practice, and the patient, let's say, has some sort of respiratory issue, well, I'm gonna call the hospitalist or the pulmonologist to take a look at the patient. And this is essentially what I saw kind of during my training at educational or academic centers. In private practice, I have never seen this because the hospitalists, they get paid by number of patients that they see. And I'm not saying it's all about money. Essentially, that can motivate some people to take care of certain things. So this is very hilarious. But in the hospital, in the real world, patients are best taken care of by a multi-team approach. Orthopedic surgeons, the hospitalists that taking care of them. You have if we're talking about a kid, the pediatrician, and sometimes if a young kid has a fracture, we'll consult the pediatrician to come in and write medications or to assist us during this process. So this was hilarious. Ortho does not want to just refuse taking care of patients and having patients on their service. We would rather just focus on taking care of what we know the best, which is fractures and ligaments and spine and various joints. We're trained in these things to take care of these patients, but in the end, I wouldn't want the orthopedic surgeon taking care of my mother's blood sugar or her diabetes or her hypertension, her cholesterol. And I wouldn't expect an internal medicine doctor to manage a patient's compartment syndrome. Or if a patient has, let's say, a bad infection, flexor tendinitis in their finger, or some type of osteomyelitis in their back or their spine, or infected total joint. I wouldn't want an internal medicine doctor or a family medicine doctor taking care of this patient. It should be taken care of by specialists who do this all the time. And that's not to say that internal medicine or family medicine can't manage these things. That's not to say that orthopedic surgeons can't manage most of the things that we consult these hospitalists for, but that's what we train for, and that's what we do. So call me if you have a compartment syndrome or a joint infection, some type of muscle injury. I'm happy to take care of that. We just ask the same. This is Dr. Webb. Thank you for watching this video, and we'll see you next time.